Hello InnerVets! Today you're gonna learn how to finally read a CBC blood work, and we're gonna talk about hematology and the size and shapes and all the different things about red blood cells that you always wanted to know. So if you work in the vet med field and you want to be the best at reading blood work, this is your video and this is your channel. So if you like it, don't forget to subscribe and let's get into it. Alright InnerVets, let's get into CBC and hematology, and we're gonna start by the basic. I'm gonna show you some graphics over here to this side, and that way it's easier to explain everything. What I'm also gonna do is define and explain those medical terminology that you might not know. That way this is a simple video for everyone that wants to learn about blood work. Okay, so the first part of this series was how to handle samples and the tubes that we have in VetMed. So if you haven't watched that, you can go back to the first video of the series. I have a playlist in my channel. You can go ahead and subscribe to if you want to learn more about VetMed. But if you want to start from scratch, you should watch the first video of this series and then come back to this one. So we're gonna start by explaining what is hematology. And hematology is, by definition, the study of blood, blood-forming organs, and also blood disorders. So basically, we're gonna study everything that's inside the blood and everything that has to do with blood. Now, CBC stands for complete blood cell count, and that's the test that we're gonna discuss today. It's the most basic test that we run in VetMed. You usually wanna run it if you have a sick patient, if you have a patient that's gonna have surgery, and a lot of more situations. And why this is the basic number one blood work that we run is because it gives you an overall answer of the state or health of that patient. So you want to run it to make sure the patient doesn't have anemia, infection, inflammation, or if something's affecting their immune system. You can find answers to multiple things in the CBC. So that's why you always want to run it. The CBC specifically measures the number and size and also shapes of red blood cells, white blood cells, and platelets, which is the three components of the blood. If we divide our CBC results in three parts, we're gonna have the erythrogram, which is referring to red blood cells. We're gonna have the leukogram, which is referring to white blood cells, and we're gonna have the thrombogram, which is referring to the platelets. How I usually remember them when I'm looking at the microscope and there's a bunch of cells everywhere is that the red blood cell is usually round unless you have conditions, which we're gonna discuss now, but usually round and like pink colorish. The white blood cells are, in my mind, I picture them as something that always has something inside. So it's like it contains something inside the cell. And the platelets are way smaller than the cells, and they're just like randomly among them, like in between the cells. So now we're gonna evaluate a CBC result that I have from the clinic that I work at, and we're gonna go line by line explaining what everything is. Starting from the erythrogram. Erythrogram stands for erythrocyte, which is, in fancy words, red blood cell. So the first three lines of the CBC result are going to be the RBC, or red blood cell count, the hematocrit, and the hemoglobin. Now, the RBC is going to give you a count of the red blood cells, and this cell is the main cell of our blood system. And what it does is transporting the oxygen from the lungs to the rest of the tissues in the body. It also takes care of moving that CO2 that the body creates back to the lungs so we can eliminate it through the exhalation. Now, how they transport this oxygen is with a protein named hemoglobin. Yes, the same hemoglobin that we're measuring here. This hemoglobin is the one that catches the oxygen from the lungs and catches the CO2 to take it back to the lungs. And the hematocrit is something that a lot of people get confused with, because I don't know if you've heard about, measure a hematocrit for this patient, please. Or what was the hematocrit in this patient? And it's usually a test where we measure with a micro hematocrit tube. And the hematocrit is an average between the count of red blood cells that you have in your sample and the volume of red blood cells. So people usually say that hematocrit is the mass of the red blood cell. Now, why is it important to measure these three? Because if these values are low, it's going to indicate that our patient has a deficiency in red blood cells, which is called anemia. This is like the story of my life. I always have anemia and I'm falling asleep everywhere, but storytelling for another video. Now, there's also different reasons why we could have anemia. We could have red blood cell destruction, for example, when they eat some toxin or poison that kills the red blood cells. We can have red blood cell loss, like a hemorrhage.
Hemorrhage.
For example, when we have a hemorrhage. I think I said it right. Or we can also have an issue with the organ that produces the red blood cells, which is the bone marrow.
Bone marrow.
So 3 reasons why we could have anemia: blood destruction, blood loss, blood production. Don't forget about it. Now, what happens if these values are high? It can be due to dehydration. Most of the time it is because of dehydration. But we could also have some breeds that are prone to have high red blood cell count, like for example dachshunds or greyhounds. I feel like greyhounds is the number one of all the weird diseases that a breed can have. But yeah, that's how you're gonna read these 3 values and why it's important. Now, moving on to the next line, we're gonna have the mean cell volume. And how I remember it is volume, something like volume, you know, and size. I don't know how to describe what I'm thinking in my mind, but basically volume, a glass with water, and it's like longer. So size, volume, I don't know. But with the mean cell volume, we're gonna evaluate the average size of the red blood cell. When we have smaller cells than usual, we're gonna call it microcytosis. Micro for small, cytosis for cell. And when we have larger cells than usual, we're gonna call it macrocytosis. Macro for big. If you can see on this picture, I got this picture from eClinPath, which is a very good website if you want to learn about lab stuff. In this image, we can see that we have red blood cells of different sizes. We can see a few platelets as well. And over there, right in the higher edge of the image, we can see a white blood cell. And when you have different sizes of red blood cells, that's called anisocytosis. Aniso coming from uneven or unequal, and cytosis coming from cell. Next line of our CBC is the mean corpuscular hemoglobin. This is going to tell us the concentration of hemoglobin that the red blood cell has. And if you remember before, hemoglobin is very important to transport oxygen and eliminate the CO2. So how we see hemoglobin in the red blood cell is with color. In this, we only have 2 options: having normochromic cells or hypochromic cells. Hyperchromia doesn't exist. I can't even remember how many times my professors in the university told me hyperchromia doesn't exist. It doesn't exist. Basically, if you have hyperchromia, it's only because of an artifact, which is an error, maybe in the machine that read the blood cell or in the microscope or something, but it's not real. So going back to what MCH means, it's going to tell you the concentration of hemoglobin that the cell has. So if you have less concentration, you're going to have hypochromia, and that means that your red blood cells are going to look a little bit more pale, and if not, they're going to be normal and they're going to have that same pinkish, reddish color. And fun fact about this is why when your patient's gums are pale, it can mean that they have anemia. So Try to remember color, hemoglobin, anemia, concentration. Now, why this happens? Why can we have less hemoglobin in the red blood cells? One of the reasons is when we have a regenerative. Okay. One of the reasons is when we have a regenerative anemia, and that's because the bone marrow is trying to generate more red blood cells because you have a deficiency, and those red blood cells are not going to be well done because the bone marrow is like, oh, I have to hurry up and create more red blood cells so my body doesn't die. So basically the bone marrow is just releasing baby red blood cells to supply the body, and that means she's not gonna do the job very well because she's in a hurry. Another reason can be copper deficiency or also vitamin B6 deficiency. Next line, we have red blood cell distribution width. And this is gonna tell us the variability of the size of the red blood cells. So even if we have larger sizes or smaller sizes of a red blood cell, our RDW is going to be high. It doesn't matter if it's larger or smaller, the variability is high. And now last line of our erythrogram is going to be the
reticulocytes.
And now the last part of our erythrogram in the CBC is going to be the reticulocytes. And in here, we're going back to the bone marrow cooking analogy because reticulocytes are immature red blood cells. So like I was explaining before, the bone marrow is going to release immature red blood cells, which is called reticulocytes. And if we have them in our CBC, it means that our bone marrow is trying to do something about it. So that's why this value is going to tell us if the anemia is regenerative or non-regenerative. If the anemia is non-regenerative, it can tell us, oh, maybe there's something going on with the bone marrow because why are you not producing red blood cells if we need some, you know? Now, important thing to remember, most of the species have different sizes, shapes, colors, and different morphology in general for red blood cells and reticulocytes and white blood cells. So in this video, we're gonna focus more on canines and felines because we're gonna talk more about small animal medicine. But in the website that I mentioned, eclinpath.com, you can find a lot of different pictures if you work more with horses or exotics or something like that. Now let's jump into our leukogram, which is the part where we talk about white blood cells. In this CBC report, they give you a WBC count and a percentage of all the white blood cells. We're gonna discuss each of them and what they do. The neutrophils are the most important white blood cell, I would say, and the most common one in the blood circulation, and they usually react to inflammation, infection, and stress. This cell is capable of phagocytosis, which means that she's basically gonna eat whatever harmful thing is in your blood circulation. And that's why it's the most common one, because if you have an enemy somewhere, aka bacteria, in our circulation, this cell is gonna try to find it and eat it so we can be safe. I feel like I love the neutrophil because it can have so many shapes inside. It's like purple, like bright purple, and like sometimes, most of the time is like the first image that you can see here, but it's just always different. I don't know. I like it. Okay, so when the neutrophils are high, we're gonna call it neutrophilia. And that's gonna be because we might have an infection going on, or we have inflammation, or it can be also due to stress. So you can definitely think that that feral cat that escaped and freaked out everyone at the clinic before getting that blood draw definitely was stressed. And neutrophils can be high due to stress. So if neutrophils are high because of stress, how do you know if it's just stress or the patient is actually sick? Well, that's why you also have to evaluate the rest of the blood work so you can integrate everything and see what's going on. Because if you have a dog that has a huge abscess in the mouth and the dog was super stressed when you were taking the blood sample and neutrophils are super high in the blood work, you're not gonna think that that level of neutrophils are high just because of a stress if the dog has a huge abscess in the mouth, which is obviously an infection. You have to correlate the history of the patient, the symptoms that they have, and the rest of your blood work so you can come to a conclusion and diagnosis. Other reasons why neutrophils might be high is neoplasia, or in simple words, cancer, and also Cushing's disease or steroids. Now, what's the difficult part about this? When the neutrophils are low, it can also mean that we have an infection. It can also mean that we have inflammation going on. And this is tricky because you would say, oh yeah, if it's high, yeah, of course, infection. But then if it's low, it can also be an infection. But remember, always correlate the rest of the history, symptoms, and the rest of the blood work. Neutrophils can also be low because of bone marrow disease, or it can be low for immune-mediated diseases. Immune-mediated diseases is when your own immune system is attacking your body. So as an example, we have lupus in humans. I think that's the one that Selena Gomez has. And we can also have low neutrophils because of toxins or toxicities with some drugs. Our next cell in the list is lymphocytes. This cell comes from lymphoid tissues like the lymph nodes, the spleen, the thymus, and the bone marrow. They play a huge role in cell-mediated diseases. Like we were talking about the immune-mediated diseases. When we have low lymphocytes, it can be because of Cushing's disease, or it can also be due to stress. They can decrease if we have an acute systemic infection, or if the patient is going through immunosuppressive therapy with prednisone, for example. Now, on the other hand, lymphocytes can be high if we have Addison's disease, or if we have a lymphoid neoplasia or cancer, like lymphoma, for example. Next cell is the monocytes. And the job of this cell is phagocytosis, which we said before, it was like eating things, and antigen presentation and cytokines production. We're gonna have monocytosis if we have inflammation going on, or infection, neoplasia. If our patient has like very chronic allergy issues, this can be high as well. The monocytes are gonna help fight infections and remove everything that's not good, like dead cells or damaged cells. They also help with the tissue regeneration. When the patient has a wound and it's healing from that wound, those monocytes are going to take care of removing the dead cells and the damaged cells and help with the regeneration of that tissue. The next cell is eosinophils, and this one is going to be increased especially when the patient is fighting against parasites, infection, or other infection. It's also very involved in allergic responses, so we might also have an increasement if the patient dealing with allergies. In this case, if we have a decrease, that's going to be normal. Their normal reference value is usually 0, so it's only important if we have high eosinophils. But if our blood work has like very, very, very low eosinophils, that can also be due to decreased bone marrow production, or it can be also because of corticosteroids. So when we're treating with a steroid, or when we have a lot of stress going on, or when we have Cushing's disease. And very similar to the eosinophils, the basophils are going to also react to immune responses or allergic reactions or parasite infections. The basophils contains histamine, which gets released when we have allergies and symptoms like sneezing and coughing and hives and itchiness, etc. So good thing to remember is that we usually take antihistamines for that. So basophils have histamines. We take antihistamines to control that release of histamine, and we don't have the symptoms. It's a little bit more complicated than that, but it's just a way of remembering what basophils are. And now, last part of our CBC is the Thrombogram, which evaluates the platelets. The platelets are the main cell involved in the bleeding control, and they do that with clotting processes. So the platelets count is going to give you information about how the clotting process of the patient is. And this is specifically important if our patient's going to have surgery and we're going to make our patient bleed. Now, this is also tricky because we can have a low count of platelets if if we have a lot of platelet clumps, which is very common in some samples. And this is when all the platelets stay together and it looks like a clump. I don't know how to explain it. I can show you a picture. This clumping issue, we can have it when our sample has a lot of clots in there. And we discussed this in our previous video about handling samples, so you should go watch it if you haven't. And we're also gonna have decreased platelets if we have certain conditions and diseases with the coagulation system. So you wanna make sure to have this value before you do anything on your patient for surgery. And that was the last part of our CBC result. In the next video, we're gonna talk about chemistry and we're gonna discuss all the lines of our chemistry results like we did with this one. So if you want to become an expert in reading blood work for your patients, you can follow this series and subscribe to the channel so you get a notification every time I have a new video. Thank you so much for watching, and I hope this video was helpful for you and that you were able to understand a little bit more about why we do the things that we do at the clinic and why our patient is so sick and what's going on with them. Remember that if you have any questions, you can always leave a comment below. I love answering questions about vet med because sometimes it's something that I don't even know and I have to look it up and study, so it helps me as well. So go ahead, don't be shy. I hope I see you later in one of my next videos, and subscribe to this channel so you can learn, laugh, and grow together.